So I have been talking about hospitals closing, and I want to dive deeper into it. I'm going to talk about an article, and I'm going to read a passage from a book that I'm reading. This one is titled Hundreds of Hospitals Could Close Across Rural America. Hundreds of rural hospitals across the United States are teetering on the edge of closure, with their financial status increasingly in peril, a new report reveals. More than 200 rural hospitals are at immediate risk of closure because they aren't making enough money to cover their rising costs of providing care, and their low financial reserves leave them little margin for error, the Center for Healthcare Quality and Payment Reform report states. Overall, more than 600 rural hospitals, nearly 30% of rural hospitals nationwide, are at risk of closing in the near future. Costs have been increasingly significant, and payments, particularly from commercial insurance plans, have not increased correspondingly with that. And the small hospitals don't have that kind of financial reserves to be able to cover the losses. The COVID-19 pandemic actually provided temporary relief to cash-strapped hospitals thanks to federal grants that help keep them open and serving patients. More than 150 rural hospitals nationwide closed between 2005 and 2019. Another 19 shut down in 2020, more than any year in the previous decade. But only 6 more closed in 2021 and 2022 because of financial assistance hospitals received while the pandemic raged. Now that federal assistance has ended, the financial crisis in rural hospitals looms larger than ever. The hospitals are going to be facing a situation where they have to spend more than they can take in to be able to pay for care, and they don't have the reserves to be able to deal with that. The problem owes to the need for hospitals to have a certain number of staffers on duty every hour of every day, while reimbursements based on the number of patients treated. Urban hospitals serve larger populations and are able to make ends meet due to the constant churn of patients coming in and out, but rural hospitals serving less populated areas are less likely to see enough patients to cover the average cost of care. An emergency department in the hospital, it has to have a physician there 24/7 to be able to deal with emergencies, so there's a certain fixed cost associated with having a physician there around the clock. In many of the smallest rural communities, the only thing there is the hospital. The hospital is the only source. Not only is it the only emergency department, it's the only source of inpatient care, it's the only source of lab services, and the only place to get an x-ray or radiology. I'll definitely make this a part 2. I'm continuing this conversation about rural hospital closures. There literally wouldn't be any physicians in the community at all if it wasn't for the rural hospital running that rural health clinic. So if the hospital closes, you're literally eliminating all healthcare services in the community. Private insurance is putting the financial squeeze on hospitals more than public plans like Medicare. Medicare actually pays small rural hospitals based on their cost, recognizing that it costs more to deliver health care in a small rural community. Private payers don't do that. So in many cases, these hospitals, the reason they're losing money is because they're losing money on their privately insured patients, not Medicare. People don't realize that Medicare Advantage plans typically pay rural hospitals less than regular Medicare does. So when people are picking a Medicare Advantage plan or when they're picking a commercial insurance plan, they need to ask the question first, is that health plan paying our local hospital adequately to deliver services in the community? I doubt anybody's asking that question. Because it doesn't do any good to have insurance if there's no place to use it. If folks pick a health insurance plan that either doesn't pay or doesn't pay a rural hospital adequately, that may put the rural hospital out of business, then it doesn't do you any good that you have insurance. Americans that live in rural communities producing all of our food, fuel, and fiber should expect and have access to the same level of primary and secondary care services that every other American in the United States has available to them. We know that it took several generations to get where we are now in terms of these services being available. You know what though? These are the same people that didn't want Obamacare, didn't want the ACA, didn't want Medicare for all. So they are now faced with this situation, and the rural hospital closures are a function many times of their own voting habits. So maybe some of these people should rethink who they are listening to when it comes to the politicians that they are voting for. So you guys jump in the comments. I do have a reading that I'm about to create here soon. It is from The Sum of Us, the book that I'm also reading that touches on this a little bit. So, but for right now, jump in the comments of this. Tell me what you think. Like, comment, share.